This is a COVID-19 infection control training module. A COVID-19 healthcare WHO standard-based module produced by Debonair Training. For medical doctors and nurses, laboratory technicians, healthcare administrative staff, all frontline customer services. You can use the bottom play bar to control the slides and navigation through this module if you get stuck on any slide. Alternatively, use the next highlighted table of content menu on the left. Note: this training module is best viewed with a laptop or desktop screen size, while it can be viewed with a mobile device. For the best mobile learning experience, please download our mobile app.
A COVID-19 global pandemic caused by a novel coronavirus has been declared by the World Health Organization. The Nigerian Minister of Health and Director of Nigerian Center for Disease Control have said thousands of Nigerians will be affected and produced guidelines to reduce transmission.
Click the forward arrow or press Enter when you're ready to continue. This is where most infections enter our hospital. People come in and out of the reception area every day, even if only one of them has an infection. If you don't take the right precautions, it could spread to everyone else. There are a few things wrong here. You may have noticed them. These will just have to be fixed. Especially now we have a coronavirus, COVID-19 pandemic, to deal with. Now let me introduce myself. My name is Adesuwa, and I am an expert in hospital reception hygiene. I have been sent here to deliver critical compulsory training for all healthcare workers in this facility. There is no room for errors here, so your full unhindered attention is required. Click the forward arrow to decide the way you want to proceed through the rest of the course. Now, you have two options. You may click Learn It to first study about COVID-19 coronavirus and the key principles of successful hygiene, or click Apply It to explore the reception area and decide how to handle potential COVID-19 infection risks. So, what would you like to do first? Welcome to the Learn It mode. Here, you'll find all the information you need to pass the questions in Apply It. COVID-19. What you need to know. We've come to a point where we hear something about this disease every single day. In fact, there's so much information out there that it's hard to understand what's actually going on. Click the forward arrow to continue. What is it? COVID-19 is a disease that's caused by a virus called SARS-CoV-2, which is one of several known coronaviruses. These viruses cause respiratory illness. Some of them only cause mild symptoms, while others can be more severe. These include SARS coronavirus, MERS coronavirus. Click the forward arrow to continue. What is its origin? The SARS-CoV-2 virus originated in Wuhan, China. The source of the virus seems to be related to the seafood on the animal market in Wuhan, but we don't yet know what animal it came from. The virus outbreak started with a group of people who exhibited respiratory symptoms. By now, it has spread to other areas in China as well as several other countries. The number of confirmed cases keeps changing daily, but sources indicate that the total was more than 80,000 by the end of February 2020. Click the forward arrow to continue. How dangerous is it? There are many unknown factors, but it is clear you're most likely to get the virus if you travel to an area where the disease is spreading. There is no need to panic, but you definitely should be careful if you're in an outbreak area. The illness is quite mild for most people, but there are also more severe cases. The mortality rate is reported to be around 3.4%, March 2020. It seems that the virus poses a great danger to older people as well as people with pre-existing conditions. Click the forward arrow to continue. How does it spread? We still don't know exactly how the virus is transmitted, but it is clear that you can catch it by being in close contact with infected people, same as any respiratory virus. SARS-CoV-2 spreads through respiratory droplets from the nose and mouth that can land on spaces around you. When you cough or sneeze, you can get infected by touching an infected surface and then touching your nose, mouth or eyes. Breathing in the droplets when an infected person coughs or exhales near you. Click the forward arrow to continue. Symptoms. The symptoms of COVID-19 range from mild to severe. The most common symptoms are fever, tiredness, cough, sore throat, shortness of breath. Symptoms may appear 2 to 14 days after exposure to the virus. Click the forward arrow to continue. What is the treatment? There is no treatment for this disease. However, infected people should receive medical care to relieve the symptoms. Potential vaccines and drugs are being developed and tested, but this will take time. Important. If you suspect that you have COVID-19, immediately contact your doctor. Click the forward arrow to continue. How can I protect myself? Here are some simple tips for protecting yourself and others from the virus. 1. Always wash your hands with soap and water after contact with things you haven't cleaned. 2. Or rub hand sanitizer with 60% alcohol content. 3. Use face protection and know how to use it properly. 4. Stay home except for very essential journeys. 5. Keep social distancing of at least 2 meters from people not members of your household. Note: information on protective measures may change. Please consult reliable sources for the latest updates. Click the forward arrow to continue. As the virus continues to spread, people are becoming increasingly cautious about traveling abroad. Here are some general safety measures for you to consider. Avoid traveling if you're unwell, especially if the symptoms include a fever, cough and difficulty breathing. If you start feeling sick while traveling, inform the crew and seek medical attention. Follow standard protective practices. See previous page. If you feel unsure, it's always best to consult your doctor and local authorities before traveling. Note: information on protective measures may change. Please consult reliable sources for the latest updates. Click the forward arrow to continue. Stay informed. COVID-19 is still very new and data keeps changing every day. There is no need to panic, but it's wise to stay informed. Make sure to look for updates from reliable sources. Think critically, especially when it comes to information that you see on social platforms. Sharing unreliable medical information is very irresponsible and dangerous. We hope you found this crash course on COVID-19 helpful. Stay safe. Click the forward arrow when you're ready to continue. In conclusion, make sure visitors clean their hands the moment they enter the reception area. Always have alcohol rub sanitizers at the entrance to the ward reception areas. They kill 99% of bacteria, fungi and viruses within 30 seconds. Make sure that the public wash their hands properly in the restrooms. Encourage everyone to wash and dry their hands properly. They cannot be allowed to return to public areas. Click menu to check apply it again or forward arrow to continue. Now, you have 2 options. You may click Learn It to first study about COVID-19 coronavirus and the key principles of successful hygiene, or click Apply It to explore the reception area and decide how to handle potential COVID-19 infection risks. Now, click the button directing you to the hospital ward. What do you have to do here to reduce the COVID-19 infection risk to flatten the curve? Select one or more options below and click Submit. Great answer. Social distancing of at least 2 meters from people not members of your household is a key behavior to flatten the curve of this pandemic, along with thorough frequent hand washing. Hand washing for a minimum of 20 seconds upon contact with outside objects, long enough to sing Happy Birthday song twice. Click the forward arrow to continue. Now, assess the individuals who are not following guidelines to stop the COVID-19 pandemic. Click on the patients to remove them from the area, then click Submit. Correct. Social distancing of at least 2 meters from people not members of your household must be maintained with all incoming patients. Touching of the face with one's own hands should also be discouraged. Click the forward arrow to continue. Which of these 3 guidelines will you use for creating posters for use in the healthcare facility? Select one or more options, then click Submit. Correct. You are grasping the principles of infection control. Click the forward arrow to proceed. You are at the reception desk and notice a boy has been far too quick going to the restroom. It's clear he hasn't washed and dried his hands. What should you do? Select one of the options below and click Submit. Absolutely right. You must not let the boy go back into the waiting area. Immediately ask him to do a more thorough wash with soap and water. Remind him to sing the Happy Birthday song twice while washing. Click the forward arrow to continue. When we clean the floors in the hospital, what process should we follow? Click and drag the items to put them in the correct order and click Submit. That's right. Follow each of these steps exactly and substantially reduce the risk of COVID-19 infection. Click the forward arrow to continue. You've dealt with all the infection risks. Everything you've learned in this course can be applied to any reception area. Ensure visitors follow the principles of good hand hygiene. Are practicing social distancing in the waiting room. Make sure all objects and floors are cleaned in accordance with guidelines. Special mention for reference, W.H.O, N.C.D.C, artists' assets and Adobe Captivate data on COVID-19, whose material has been researched and referenced in this production. Click the forward arrow when you're ready to continue. Wrong answer. It is important that you understand the infection control principle, so click on the forward arrow to proceed to the Learn It section. Incorrect answer. It seems you haven't studied the Learn It section, so click the forward arrow to proceed to the Learn It section. You've reached the end of the Learn It mode. You should now feel confident you can tackle the questions in the Apply It mode on the principles of good hand hygiene, social distancing of patients in the hospital, how the reception should be cleaned. Click menu to check Apply It again or forward arrow to continue. If you're viewing this infection control simulation via Debonair YouTube channel, you can interact directly with the online training module by clicking on the link in the YouTube video description. For more incisive training slides, to expedite the end of this global pandemic, and to minimize the damage to our health and economy, you may contact Debonair Training Limited using the following details. Click Close to exit or use the bottom play bar to go through the Learn It sections again if you want.